There are really a couple groups of patients that come in for breast augmentation. There are patients who just simply anatomically have not had a lot of breast tissue, and typically you'll hear, I want to fit better in the clothes that I buy. Another group of patients that are frequently seen are patients who have had children and have had some loss of breast volume after pregnancy and potentially after breastfeeding.
If you come in and you're interested in breast augmentation, first I try to get an idea of what size you want to be. Then we make some measurements and determine the best size implant for your body. We don't want to make you too big where it's going to be difficult to fit into clothing, although that is what some women want, but we want to try to make you as proportionate to the rest of your body as we can.
When we talk about the implants, we've got two basic types. The first are the saline implants. They're just filled with sterile salt water. If they were to ever leak or rupture, it's just IV fluid. Your body absorbs it. It's completely harmless. The other option that you have are the new generation of gel implants. Silicone gel implants that were on the market many years ago had silicone inside them that was very thin. It was rather like honey. So if they were to ever leak or rupture, that silicone could spread out into the surrounding breast tissue. These new gel implants are what's called a cohesive gel, which means they're more like gummy bears or Jell-O. You could literally cut one of these implants in half and they will not leak.
There are three basic incisions for breast augmentation. One is under the armpit, the other is around the nipple, and the one is just above the crease underneath your breast. We call it inframammary fold. I think the most commonly used incision is the one underneath the inframammary fold, although we use all the different sorts of incisions. And there are certain benefits and drawbacks to the different incisions, and some of those are based on what you might want and also what the physician or the surgeon likes to use. Implants are typically placed either above the muscle, what some people call subglandular, or under the muscle, or submuscular. The main benefit, I believe, of putting the implant under the muscle is twofold. Number one, you get a little bit more soft tissue coverage between the outside and the inside, which is better to camouflage the implant. The other reason, some of the complications that can occur with breast augmentation, for instance hardening of the breast, have been shown to be a little bit less when we put the implant under the muscle.
Before I went to the surgery, I came for a pre-op visit. During that pre-op visit, they gave me information on what to expect, and they actually walked me through everything that I was going to experience or see, changes in my body, and what was normal and what was not normal.
It's very important for you to understand that breast implants are not lifetime devices. They will have to be replaced if you're a young woman. Most patients can breastfeed after they have implants placed. Most implants will be placed under the muscle, so therefore they do not affect the gland in any way. It is also very important for you to know that breast implants do not give you breast cancer. They do make detection of breast cancer a little bit more difficult, and detection of breast cancer requires additional views where the implant is displaced and not broken in the mammography process.
Most of the surgery performed at Piedmont Plastic Surgery and Dermatology is performed in our own certified operating facilities. That means that we've been certified by the Quad A to perform surgeries in our offices. It's the highest certification that you can get. It also means that all of the surgeons are well trained and qualified to perform these procedures in hospitals and outpatient surgery centers alike.
Surgery is serious. We certainly want our patients to be happy. We want them to be delighted with their results. But the most important thing is that we keep them safe. And we want to make sure that they understand all of the risks and all of the benefits of any procedure that they're considering.
After breast augmentation, most women take about 3 to 4 days to recover. The most difficult part of the recovery is the fact that you have to keep your incisions and chest dry for 3 days or so after your surgery. Most women are doing activities of daily living within a day or two. And most women start to participate in physical activity within a week or two.
After the procedure, I get a phone call within several hours after I've been home. It's very personal, and they treat me like I'm part of their family. Piedmont Plastic Surgery has changed my life. My confidence has been restored. I'm an aging woman, and there's nothing that they can't do to help me boost my self-esteem. Anything I could possibly need from a physical standpoint, I can get right here.